I first would invite Superintendent Cromwell Henry, who is a member of the National COVID-19 Task Force, to give us his presentation. Superintendent.
Thank you, Mr. Williams. Pleasant good afternoon to all listening to this broadcast via whatever means. The police on Nevis responded to reports of 2 security breaches at a resort there on March 12th and 13th. Between March 7th and 11th, a group of 88 U.S. nationals arrived in the Federation and traveled to Nevis, where they stayed at a resort there. Their condition of stay at the resort was vacation in place. The COVID-19 Act defines vacation in place as quarantine at a hotel or other accommodation with access to an approved package of services in the context of COVID-19. The first breach occurred just after 1 p.m. on March 12th, when 2 of the guests from the group left the hotel's compound and ventured into an establishment in Charlestown. They were identified and detained, and the police were called. The second breach occurred between 1 a.m. and 2 a.m. on March 13th, when a group of 6 guests from the same group left the hotel compound to visit a nearby bar, where they socialized with patrons before returning to the hotel. This breach was also reported to the police, who commenced an investigation. All 8 guests were moved to a government quarantine facility at Potworks to continue their quarantine. The Ministry of Health in Nevis conducted an aggressive contact tracing exercise, which resulted in approximately 40 persons from the bar being quarantined for 14 days. The 8 U.S. nationals were arrested and formally charged for breaching their quarantine condition, and were this morning taken before the Charlestown Magistrate Court via a virtual hearing to answer the charges. They pled guilty and were each convicted and fined $4,000 to be paid forthwith or serve 6 months in prison. They remained at the quarantine facility at Potworks while arrangement for payment of the fines is made, after which they will be allowed to leave the Federation. Their COVID-19 tests so far have returned negative results. We again use this incident to highlight the importance of adhering to all the COVID-19 protocols when attending public events. It is also important to highlight the importance of establishments, particularly bars and restaurants, to record the names of patrons entering the premises to assist health authorities with any contact tracing investigation if that becomes necessary. In addition to the wearing of masks, hand sanitizing, and physical distancing, you can further reduce your risk of contracting the coronavirus or the corona disease by taking the vaccine. And in closing, I would leave you with this: do not hesitate, vaccinate. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Marissa Carty, who is the Public Relations Officer for the Health Emergency Operations Center, to give us the situation report. She is filling in for our Chief Medical Officer, Dr. Laws, today. Dr. Carty.
Thank you, Mr. Williams, and a pleasant good evening to everyone. This evening, I will be sharing with you the Health Emergency Operating Center COVID-19 Situation Report for March 17th. The Ministry of Health would like to bring to your attention this evening that we have one additional confirmed case of COVID-19 within the Federation. This brings our total of confirmed cases to 44, with 30 cases in St. Kitts, 14 cases in Nevis. 42 cases have been fully recovered, and there are currently 2 active cases. Globally, there's a total of 120 million confirmed cases of COVID-19. This is according to the World Health Organization's tracker. Additionally, we have a total of 2.6 million deaths thus far. In the United States, they are reporting just over 29 million confirmed cases of COVID-19, with 537,000 deaths. Within the Caribbean region, we have a total of just about 571,000 confirmed cases, with 8,055 deaths. However, within the CARFA member states, we are reporting 121,000 confirmed cases with just over 2,000 deaths. This is as of March 15th, 2021. Now, within the Eastern Caribbean states, we recognize that there still continues to be an increase in the total number of cases. In Antigua and Barbuda, we have a total of 983 cases. However, with vaccinations doses being given, they have a total of just over 14,000 vaccine doses being administered. In Barbados, we have over 3,000 active cases with over 50,000 vaccine doses being administered. In Dominica, we have a total of 157 total cases with just almost about 12,000 vaccine doses given. In Grenada, 154 total cases with 7.6 thousand doses of the vaccine being administered. Now, the Ross University students are still within quarantine. They have a total of 76 of these students. Their quarantine date ends next Wednesday, and then they would be retested, and once negative, be able to reintegrate into the society. So far, we have tested a total of 10,572 persons, with 44 persons being recorded as positive, and that gives us a positive rate of 0.4, and this is as of today. So just again to reiterate, we do have a total of 42 persons recovered. Number of persons who have released from quarantine thus far, 6,211. 2 persons are currently in isolation, with 344 persons quarantined in the government facility and 12 persons quarantined at home. Our vaccine rollout awareness campaign continues. We are just about halfway through week 3. We have, as of today, we have a total of 7,071 vaccine doses would have been administered, and that puts us at 21.4% of our target population. On the next slide, you will see a breakdown of the doses administered. So we have 5,102 doses being administered in St. Kitts, 1,969 doses administered in Nevis, again giving us that total of 7,071 doses being administered, with putting us at a total of 21.4% of our target population. Thank you so very much.
Thank you very much, Dr. Carty. Our next presenter is Dr. Cameron Wilkinson, who is the Medical Chief of Staff at the JNF General Hospital. He will make a presentation for us.
Thank you very much, Lesoy. I just want to give a brief recap of a presentation that I gave last night for those of you who missed it. We have all been through a most unprecedented period in our nation's history and our lifetime. The coronavirus pandemic is currently the greatest threat to humanity, and none of us had a roadmap of experience to navigate these uncharted waters. This is not the first time a disease of epic proportion brought the world to a standstill or shut down entire economies. The Spanish flu of 1918 infected 500 million people, or 1/3 of the world's population at the time. Unlike today, however, there were no effective vaccines available to arrest the spread. By the time it had run its course and come to an end in April 1920, it is estimated to have killed over 100 million persons. We are fortunate this time around to have safe and effective vaccines to help end this current pandemic. We therefore should not take these life-saving pharmaceuticals for granted. Some persons ask, can I delay taking the vaccine? We are actually in a race against time to stop the virus from developing more variants and claiming more lives in the process. There is therefore no time to wait. The more people who are vaccinated, the sooner we can eliminate the virus. The pandemic is like a fire that is about to engulf your home. You must use the vaccine that we have available now to put out the fire before it consumes you and your family. Turning a blind eye to reality does not eradicate the problem at hand. To date, more than 2.6 million persons are dead from this virus, and more will be lost if we don't take action. We, however, have the tools to prevent the spread of this deadly virus and to limit the death toll by simply following the instructions based on science and the acceptance of a vaccine we know is safe and effective. Some persons ask, who is responsible for leading this fight? The virus threatens every element of society. It is therefore not merely a health issue, and the problems created by it cannot be handled by any one governmental ministry. The Ministry of Health cannot and should not therefore be expected to handle this crisis alone. It requires the whole of government. So what is the whole of government approach? The whole of government approach means different government agencies with varying mandates working together to combat the common enemy, the COVID-19 pandemic that threatens our lives and livelihood. We therefore here have every single ministry of government involved in this fight. In the whole of government approach, it follows that the Prime Minister is at the top of the decision-making process, and successes or failures in the fight would be attributed to him. We are happy, however, that we are one of the few nations to have successfully fought this deadly virus so far, with no community spread, no major hospitalizations, and no death. However, government alone cannot stop the spread of the virus without the involvement of the whole of society. And so what is the whole of society approach? The whole of society approach in the fight against this virus means government engaging all stakeholders in the fight. In particular, the engagement of the communities is at the core of this fight, and so we have to reach communities, families, and individuals. If communities are engaged and empowered with the knowledge needed to fight this deadly virus, we will succeed, as they will do the necessary things to protect themselves. From our community education sessions, we have had hundreds of individuals who come forward either at the time or days later and accept the vaccine. Some persons ask, why didn't you start the education program with the vaccines earlier? The right information must also be given at the right time to be effective and for people to understand the gravity of the situation and the appropriateness of the interventions needed. And that is why we started our education program in January 2020, way before the virus was declared a pandemic. We started by providing the nation with information about this new or novel virus. We spoke about the signs and symptoms, the mode of transmission, and the severity of the disease and the consequences of inaction. We also made sure that you were educated about the non-pharmaceutical measures needed to fight this virus. We warned that these measures would have to continue until a safe and effective vaccine was found, as this was the only way we can get out of this crisis. We never let up with our education program, coming to you every week here and sharing information about the pandemic. It was in December last year, December 8th in the UK, and December 14th in the United States that the first vaccines were rolled out. We here in St. Kitts, like the rest of the world, then began to step up our vaccination education program in a timely manner after that. The onus, however, must be on each and every one of us. We need the combined strength, unity, and effort of all in the fight if we are going to be successful. You do not need a formal invitation to participate in the fight. You can use whatever platform you have available to get the message out. And in this era of fake news and misinformation, the media must understand that they also have a crucial role to play with balance and factual reporting so that the public can be well informed. What can you say about our vaccine rollout? On February 22nd, we began our vaccine rollout. In just over 3 short weeks, we have vaccinated 7,071 persons, or 21.4% of the target population. This is very significant, and they put the challenge out there to you for us to get to 1/4 of our population by mid next week. We know that the jab is effective. The first gives you 76% efficacy, and by the second it rises to 82.4%. But the effectiveness of preventing hospitalization, severe disease, and death is even higher if we get to herd immunity. Now, some persons ask, is the Astrazeneca vaccine safe? Health authorities in several European countries suspended the use of Astrazeneca vaccine following reports of formation of blood clots in some persons who were vaccinated. It is important to note that blood clots can occur naturally and are not uncommon. The WHO data shows that of the 268 million doses of COVID-19 vaccines that were administered worldwide, no serious side effects or deaths have been found to be caused by them. They have continued to report that AstraZeneca is an excellent vaccine and that no causal relationship had been established between the shots and the health problems that were identified, and that vaccination should continue. Even in Denmark, where the rollout was suspended for 14 days, the director of the national board there said that while the investigations are taking place, there is good evidence that the vaccine is both safe and effective. The European medical regulators said that there is no indication that the Oxford AstraZeneca vaccine is linked to an increased risk of blood clots. They said that the number of cases in vaccinated people was no higher than that in the general population. There were 37 cases of persons who developed blood clots from 17 million persons who received the jab in Europe. Of note, 2% of persons who get COVID-19 disease develop blood clots. And of the 17 million persons in Europe who got the blood clot, of the 17 million persons who got the vaccination, the 37 persons who got blood clots, this comes to 0.0002%. In other words, you are currently 10,000 times more likely to get a clot if you got COVID-19 disease than if you got the vaccine, if there was found to be a link. And that is why they said the benefits of getting the vaccine outweigh the risk. The final decision from the EMA would be released tomorrow, and both Italy and France said that they would resume their vaccination program once they get the all clear. My final advice, despite all the hard work that we have done in containing the virus here, everything can be lost by a few irresponsible persons. We must all work together to keep our country safe. We must not hesitate and get vaccinated as soon as we can. The vaccine is guaranteed to protect you. It can prevent you from getting sick, from getting severe disease, from being hospitalized, and more importantly, from dying. I thank you.
Thank you very much, Dr. Wilkinson, for your presentation. I now invite Mr. Abdia Samuel, who is the chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA, to give us his presentation.
Thank you, Mr. Williams, and thank you for your wonderful introduction. I think you set the pace for our reporting today. I want to focus this afternoon on compliance, and it's critically important that we do. Every time we come, we speak about several things, and compliance is a critical thing that we need in order to continue with the successes we have made. For example, Superintendent Henry would have made a reference to record keeping. We have spoken to the businesses, the compliance officers. When they visit, they encourage persons to have a questionnaire so that they can ask individuals questions for symptoms of the coronavirus and so on. Having the names, I know that once you receive approval from the police for any event, one of the terms of and conditions for you to have these events is to record the names and have these names for a minimum of 30 days, before. And we see the importance of having these names. They help us with the contact tracing that the Ministry of Health will have to do in the event we have incidents like those that happen on the weekend. We are all vulnerable to these incidents. And I am appealing to the business sector, in particular entertainers, promoters, and those businesses that host such events, to please keep record of the individuals that come in and out of your establishment. We are also looking at many breaches. The breaches is not just only individuals who are in quarantine. Once the police gives you a number, a specific number, according to the size of your venue, please adhere to those numbers. One of the things that we are seeing based on the reports from the compliance officers and the police officers is that persons will begin to log the names, institutions, will begin to log the names, and when they reach certain amount, they stop logging names. So by the time an inspection is being done by our security forces, they will see that maybe they may have the job short of the number. That is totally unacceptable, because the officers have been tasked to go in and count the number of persons that are in there. And what they normally do, they will ask you to lower the numbers. If they ask you so once, they ask you so twice, the third time, then they are going to shut down the event. That's the reality. We have to protect, in the interest of public and public safety, we have to protect the general public from such situations. So I am appealing to everyone who are hosting events. Once you get a number, please stick to your numbers. If you see anything out of the ordinary, please question it. We still have the potential for outbreaks, and we have to do everything that we need to guard against such. So again, please, when you receive permission to host these events, we are asking you to keep the records of the individuals, do temperature checks, ensure that persons sanitize before entering and while they are at your establishment, and even encourage them to do so when they leave in. And if necessary, have a questionnaire so that they can be filtered if necessary. While we're on compliance, we're going to also appeal to persons in the using public transportation, buses, and also the water taxis and the ferries. One of the major complaints we are getting from the security officers and other individuals providing these services is the non-compliance of our citizens and residents using these services of not wearing the mask. Let me just inform you that we are in the process of printing the tickets, and soon and very soon we will have individuals out there doing their job if they need to issue these tickets. We are appealing again to bars and restaurants in particular to ensure that they carry some of this, do some of this recording. What do you say? Well, Mr. Samuel, what do we need to record? Well, record the date, the name, the address, and a contact for individuals accessing your property. Along the lines of compliance, it has been approximately 5 months since our borders have opened. We opened our borders on the 31st of October, and we have seen with that the tourism sector has also opened up. The COVID-19 task force will be conducting an audit exercise of the tourism industry in particular, but with a focus on the facilities that are providing vacation-in-place services as well as quarantine services. This team will be comprised of a multi-agency team from various establishments within the public and private sector. And the main focus will be on auditing the hotel. We want to see what has been happening in this first phase of operations, and then from there on we are going to make some recommendations to the federal cabinet to amend some of the policies governing these institutions. We want to welcome MSR Media. We are welcoming their partnership where the filming of a movie 1 year off that is being carried out in Nevis will now be extended to St. Kitts. MSR Media will begin filming part of the movie in St. Kitts from the 21st of March, and for that we are very happy. I want to end by making a public appeal. You heard everyone talk about the vaccination and what we need to do. And we are going to continue every week. We're going to continue every day until we reach that threshold. I am asking the community-based volunteer groups to go to every single household in your community and ensure and engage and ensure that persons that need to vaccinate do go and get themselves vaccinated. It's a bigger cause than Mr. Abdiel Samuel or any members of the task force, any government ministry. It's a cause for the Federation of St. Kitts and Nevis, and we need to reach this threshold so that we can return to a sense of normalcy. Again, it's really the best shot that we got to get back there. So again, let's stop the hesitation, let's stop the negativity, and let's vaccinate. Thank you, Mr. Williams.
Mr. Samuel, thank you very much. That brings us to our question and answer segment. And the first question is from WinFM Media. Can private medical institutions, practitioners, procure and offer other vaccines? Dr. Wilkinson.
Well, for one to bring any drugs or vaccines into the country at that scale, you must have a pharmacy license. And so if any private practitioner has a license, they are free to bring in and offer other vaccines.
This question, I think, was answered during Superintendent Henry's presentation. It's from WinFM, but nonetheless I would ask it so it can be reiterated. Were the 8 people involved in the breach on March 11th and 13th respectively tested after being quarantined at the government facilities? And maybe as well that you can reiterate what took place at the court today.
As indicated in my presentation, yes, both persons were all 8 persons were tested. I think they were either tested yesterday or today, but the results were negative. Results came back today and they were negative. At the court, as I mentioned, it was a virtual hearing, so they were at the place of quarantine and they were connected to the court via a Zoom link, and they would have had representation from counsel. charges were put to them, and they pled guilty. And so the magistrate heard the facts from the prosecution and mete out the fine of $4,000 to each of them to be paid forthwith. Alternatively, they would face 6 months in prison if the fine was not paid. Thanks.
Thank you very much, Superintendent. This next question goes to Dr. Wilkinson. Dr. Wilkinson, last night on Leadership Matters, you were asked if Dr. Terence Drew and Dr. Denzil Douglas took the vaccine, and you dodged the question. I am asking you for a straight answer now. Did any of these two medical doctors take the vaccine?
Thank you for the question, Lesroy, and it was not my intention to dodge the question at all, and so I'll be as direct as I can be right now. And I said last night that we know that the vaccines, that they are safe, that they are effective, that they can decrease hospitalization, that they can decrease the incidence of severe disease, and that they can decrease death. And so the vaccines, by taking the vaccine, it actually protects you. It's a life-saving measure that you're taking. I said also that more than 90% of the doctors in the Federation, knowing this information, willingly came forward and took the vaccine. I myself, I took the vaccine. Now, the two doctors you're asking me about, they are public figures, and you can reach them and ask them if they did, and if they didn't, you can ask them if they did not. But I'm telling you that more than 90% of the doctors in the Federation took the vaccine. It's not for me to come and give out the list of the 90% of doctors who did. Thank you.
Okay, well, it appears that you're still dodging the question. Are they in the 10% who have not taken it? I suppose we will find out. That brings us to the end of our question and answer for today's briefing, and I want to thank everybody for their participation in today's briefing. Superintendent Henry, Mr. Abdia Samuel, Dr. Cameron Wilkinson, Dr. Marissa Carty, Mrs. Christmas Jacobs, ZIZ. We have our co-chair of the Disaster Mitigation Council who is here with us and who always comes and offers her support here at the NEOC, the Honorable Wendy Phipps. We also thank Vesta and all who make these briefings what they are. Because, of course, you know, information is key. Information is vital. Reliable information with respect to the management of the pandemic. We thank all the media houses who continue to partner with us and to provide that reliable information to our population. Thanks to all of you, and we continue to adhere to the pharmaceutical measures that have been instituted for our own health and our own safety. Take good care. Until next week, Wednesday, I am Lesroy Williams.
Is on. face. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, one people. We are roll up to roll up, cause no man's alone. Do what's right, cause I love you, and we're in this together. My sister, my brother, I don't wanna lose you. I love you too much. I think it's better for us, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah. It's better for us. Tell your mommy to let it roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.